efforts of the staff that have made it possible for the transition, the very difficult transition that took place between a fully owned state facility to a fully owned federal facility. This transition has been quite a difficult moment because it is not easy to expect people who have never had experience with the system to totally transform and start operating in a different capacity. So it has been quite difficult. But I wish to state that the staff have been quite cooperating and willing to accept the change. And they took it as a challenge. And that is why we were able to, within a period of just 1 year, transform from our former status and image to a new image that we are now celebrating. So whatever is going to be done today is not to say that the staff has not done well. Whoever is choosing is to choose the best among us. All members of staff have done their best, except a few. And the few that have done well, I'm sure they will have noticed our major concern had to do with issues of fraud. These are issues that we cannot tolerate. Issues of extortion of patients, these are issues we cannot tolerate. But other issues, we can accommodate them as issues of transition and hoping people will change over time. But the issue of fraud and extortion of patients, I believe, if people have the changes, they don't have a place in our system. The other issue I want to state is that the hospital has done a lot in terms of infrastructural development and manpower development. We were just 5 days ago with the Honorable Minister of State to commission about 14 projects that were executed within a period of 1 year, and all of us have seen them. I'm sure the members of the will not be ones to judge ourselves. The members of the public will agree with me that there are a lot of changes in the way we operate. I'm not saying we are perfect yet, we are still moving, but I think we have gone a long way. So I wish to urge the members of the public to support us to go where we want to go. Finally, I wish to thank all those that have responded to our invitation, and particularly the guest speaker who had to cancel his schedule so many times to accommodate us. I welcome him to Bauchi. I'm sure he has been to the hospital before, but I'm sure he will agree that he got the same hospital that he knew before that he gets to today. So I wish us happy deliberation.
As I said earlier, to chair this occasion is Mr. Abdul, the head of civil service of Bauchi State, who is here ably represented by the Permanent Secretary of General Administration, as I mentioned.
It is my singular honor and pleasure that is opportunity to I am representing ATBUTH to express very important moment of the start of the any government. Can use to motivate one force. It is the cognizance of the key role played by this motivational factor that the United Nations, I therefore commend the CFD for the initiative, and I hope it is a challenge. I hope whoever achieves it this year, somebody will push him aside and achieve it next year. Because that is the essence, to motivate people to be competitive and also competent. By competing for excellence, you end up by being competent, and which also makes you to perform your official duties efficiently and effectively, and you ensure effective service delivery to the good people of Bauchi State and beyond. With this short opening remarks, I once more commend the CMD and also challenge the staff of the hospital.
As the chairman was delivering his speech, this gathering was so privileged to have the Honorable Commissioner, Minister of Health, Bauchi State, Dr. The Secretary hosted the conference, like the tiger man, is also here. Sir, you are welcome. And the instruction on the objective is check well before you get. So the man went, he got the test it, and because the instruction says check well, he thought he was to shake his body when an important topic. Healthcare delivery in our contemporary society is journey so far. Just before I introduce the person that is going to introduce the speaker, we also have to come forward and introduce to us the guest speaker as we take the presentation on this very important topic. Mr. Manta, a round of applause.
My pleasure actually to introduce the speaker of the meeting. He is no other person than Mr. Abubakar in 1996 by the Senate of the University of Maiduguri. In July 1996, Dr. Gombe was appointed the Pioneer Medical Director of the Federal Medical Center Gombe, a position he served for 6 years. While he was the medical director then, he was called by the Abdul Salam administration to serve as the Honorable Minister of State for Health from August 1998 to May. He served that position from August 1998 to May 1991. Dr. Gombe was appointed the director of the Federal Civil Service Commission in 1999 and was posted to the Minister of Petroleum Resources till June 2007. During this period, he also
attempt to go through historic perspectives and then look at what the current situation is and what the future is, and eventually extended to the local population, especially those living close to government stations. Over the years, various administrations formulated health policies which were welcomed, but at the point of implementation became a problem, while some suffered discontinuation by successive governments. The first meaningful health policy in Nigeria, though deficient, began with the first 10-year national plan of 1946 to 1956, wherein health was put on the concurrent list, with comprehensive health care based on basic health care services scheme, disease control, efficient utilization of population receiving health care from 25% to 60%. The basic health care service scheme policy, which was incorporated into the development plan, had the following objectives: to initiate the provision of adequate and efficient health facilities and care for the entire population. In the 80s, African economic and social progress over previous decades began to come undone. Heavy debt repayments to the rich countries. With the economic and third world debt crisis in the 1970s and 1980s, developing countries were pressured to take structural adjustments. Economies were structured to ensure debt repayment to the rich countries, and this meant reducing the standard of living for most of our people. The typical prescription to this economy included privatization at all costs, circumstances of the country. Almost all developing countries were handed the same medicine. As a former World Bank economist and Nobel Prize winner for economics, Joseph Stiglitz once noted, the IMF typically handed out this job. Attaining this, therefore, means a multidisciplinary approach reaching out to education, water resources, agriculture, and programs. Massive and preventable communicable infectious diseases, side by side a growing lifestyle induced by worsening conditions with excess mobility. With excess mortality at young ages, health inequalities and disparities among different groups, hence the need to take urgent measures in Nigeria are among the worst in the world. Nigeria shows 10% of the global disease economy and is currently in the health issues. The health indicators in Nigeria have largely remained below pound 3 times of 1999. Nigeria is among the 25 poorest nations in the world, with 70% of its population, despite being endowed with rich human material resources. Both the poorest and the federal forms of assistance were poor. In 1960, only 15% of our population was poor. 1980, 28%, 1996, 56%. And only God knows what it is today. This is only 1%. Now this slide shows, I deliberately picked as recent as 2009, the life expectancy of Nigeria is expected to be 48 to 1 year. Now, unfortunately, the sub-Saharan average of that means that has a life expectancy of 1.6 years. Cameroon 51.4 years. Chad, look into it. Now, next slide, please. I tried to get the data that will localize us. And if you look at the geopolitical zones, the Northwest has the worst indices. The Northwest followed by the Northeast. And this expenditure over the years, our public health care system remains inefficient and contributes to health poverty trap, a state of being trapped into low productive capacity and income deprivation. The rainy season, living on dangerous terrain, poor community involvement in rural running the
present our staff that merits it. And before we do that, the committee was set up by the management, which I chaired. We have some of our members that as best staff of the year, both senior and junior categories. We have first position, second position, and third position in this category. And we have the best department in the hospital. And we look at the most improved department. We have taken over the hospital about barely 1 year ago. So we compare the time we come and now, which department has improved remarkably. And we look at the best cleaner in the hospital and the best security officer. And also look at the overall best staff in the hospital. The best among the best. So to do that, actually we most of the nation from the department and other unit heads, because we feel that these people are the ones that are working closely with this staff, and they can tell you about individual staff. And they give 3 nominees from each department and each category. And we went ourselves into the field. We interviewed some staff without even knowing what they are doing. And physically we look at the staff also nominated by the department. We look at the appearance, we give some marks. We look at or ask for punctuality from his colleagues and the seniors and juniors also. And we look at the relationship with the colleagues, the senior colleagues and the junior colleagues. We ask about discipline for that staff. We also look at the work output, how they've been doing this work, and then we look at the relationship with the management. That one we use the file of the officer to see whether there's any form of query in that file. And we look whether there is any commendation in that file. So that's the mark to him. So that's what we use actually to grade it.
Thank you very much. Thank you very much. Thank you very much.
All recipients of the award, and on behalf of the departments that received the awards, we want to thank the management, because without your support, without dedication of the staff of the department, these awards wouldn't have been given to us. So we want to thank you very much, and we believe that we will improve even more. And as it was said, that not every year the same people will be receiving, because now I think it will be a race for everybody to receive the award. Thank you very much also for organizing this wonderful occasion, to the management of ATBUTH.